I'm your host, Dean Anderson, and on today's show, we have lived experience counselor Trevor Mason on the show. Hey, Trevor.
Hey, Dean. How you doing?
It's lovely to see you.
Thank you very much. Lovely to be here.
We have had the pleasure of interacting over the years and meeting in different locations and conferences and all that sort of stuff. And we've never really had a really good opportunity to kind of chat about the work that you do. And I'm going to use this opportunity in a much bigger sense, opposed to just having coffee and talking. There has been an opportunity on this show specifically, talking about stigma and addiction, to talk to addiction counselors. And even though I am one, we have talked to so many other individuals in so many avenues and so many things. We've had some addiction counselors talking about family services, but I have yet to have an addiction counselor talking very specifically just about addiction, right? We've had people talking about their programs and things that they do and treatments and specific topics, but I want to talk to you about being an addiction counselor and what that looks like. So I'm going to throw it right over to you and say, Shane, what does it mean to you to be an addiction counselor? What is it? What's it all about?
Well, again, to me, it's about helping the individual. Mm-hmm. I mean, ultimately, addiction to me is a byproduct of life. I mean, I know, again, in life, I didn't say, hey, can I have a piece of that? Just like nobody says, can I have a piece of that diabetes, right? I mean, these are things that develop over our life because we're the sum of all of our experiences, right? So I know that, again, the whole idea of being an addiction counselor to me is trying to meet somebody where they're at, trying to figure out, again, what are you getting out of this? And trying to show them that, hey, there's a lot of negatives associated with this, and how can we make a change? Because really it's like a change of lifestyle. It's not easy to just set something down. And I find as an addiction counselor working one-on-one with people, it's about making that connection. How can I make that connection so you feel safe? You can talk to me about what's really going on. Again, what are you trying to avoid? Because I think a lot of it has to do with avoidance. I don't want to feel A, so I B. So for anybody, B can rapidly become a problem, whether it's a substance, whether it's a behavior. I mean, for some people it's shopping, for some people it's eating. For a lot of people it's drugs and alcohol, right?
So you're specializing in drugs and alcohol, correct?
Yeah, I specialize in drugs and alcohol. That's where my passion lies. But again, it's really the same tools. Like if you take away the substance being the problem, and understanding that it's what I'm using the substance for that's really the problem, right? Because ultimately, even if you take away alcohol or take away drugs, yes, life might get a little bit better, but what's the underlying reason that you were using drugs and alcohol in the first place, right? So, drugs and alcohol become, as they say, that unmanageability in our life. I mean, they push that unmanageability, and life becomes unmanageable because of tolerance. I need more alcohol, right? I'm not getting the same thing out of the same amount of drinks. So now I become tolerant. Now from tolerance breeds dependence. Now I'm dependent upon this. If I don't have it, I have the opposite effect. So the fact is, once we take that away, there's still those underlying issues, the root causes that had us using in the first place, right? Again, for me, I like to say when I found drugs and alcohol, they weren't a problem, they were a solution, right? And as a lived experience counselor, I identify I'm a grade 4 recovering addict whose problem's Trevor, right? Because again, the fact is, I truly believe that this is the problem, right? It's compounded by what we thought was a solution that's no longer a solution, because again, it's not a viable solution because of tolerance and dependence, right? And plus, I'm not doing anything to actively deal with the emotional content that's driving the use in the first place. So all I'm doing is avoiding it. And if all I do is avoid it, as soon as I come back from, whether it's high or escapism, however you want to call it, the issue's still there. So in being an addiction counselor, it's about, okay, so how do we reduce the unmanageability, right? And again, I'm a big fan of abstinence. I mean, some people want to work a harm reduction program. I will work that with them. But it comes down to, okay, how are we going to make your life a little bit better? How can you do a little bit better today? That's just one day at a time, right? Again, I am a big fan of mutual aid, and 12-step is a really, really standard mutual aid program that's available everywhere in the world. So one of the things they say is, we didn't become addicted in one day, so remember, easy does it, right? Like, I mean, things aren't going to get better like that. So about trying to get the person to understand that and accept that, and let's just work through this one step at a time. First step being, okay, let's set down the substances, let's reduce the unmanageability. But I mean, that's really hard because of withdrawal. And I mean, withdrawal is not just physical, it's also emotional, it's spiritual, right? The physical withdrawal is really easy, like a week, right? Well, cannabis is 28 days, but for most other things, and I mean, although we like to think it, generally withdrawal won't kill you. I mean, although alcohol has the, has the potential to kill you. But it's funny, we start talking about societal recovery and how it's, so ingrained in our society, alcohol, but it's a substance that if you drink enough of it, it'll kill you. And then if you drink it long enough and you stop drinking it, it can kill you. But hey, let's party.
Yeah, it's coming from all different directions, eh? So that was a lot of information just there, looking at, and I'm trying to, and I can see why, I haven't had a lot of addiction counselors on the show, because I want to put on my addiction counselor hat, not my TV show personality hat, and I want to jump right in. What I would love to hear is, there's a couple of things. First off, you said, at the beginning of talking there, that meeting the person where they're at. What popped into my brain was the idea of, rapport and safety and those sort of things that you put out there. And I would love to hear, what are some of the ways that we build rapport or get people to a place of being able to share or participate in the process of counseling. Because I know that there's a part of the reason why addiction is a problem is because of, and I'll use the term loosely, treatment resistant, right? So I know that rapport is really important. What are some of the things that we look for or do to help build that rapport?
So again, reminding the person that everything we talk about is confidential, right? I mean, even in situations where I'm contacted by, say, a parent, and I'm going to work with the children, right? Like, this is between you and me. I don't tell mom and dad anything, right? So like, look, this is just a conversation between two of us. Maybe I can help you out, right? And if I can't help you out, I'm going to get you to the next stage, somebody who will. But let's start here, and let's just, be honest. Judgment free, right? I'm not going to judge. And again, being a lived experience counselor, then I can use a little bit of self-disclosure and try and help them out so they understand that they're not alone. I mean, the fact is that we understand now, and the numbers are out there, that 1 in 3 families are affected by mental illness. And addiction or substance use disorder, right, is an Axis 1 mental illness. So when we start talking about it in that way and trying to take away and break down, again, the stigma, the guilt, and the shame that are associated with it, I mean, how did we end up here today? Okay, so yeah, there might have been a lot of bad decisions, but we can't change those decisions. About let's concentrate on how we're going to move forward, right? Again, trying to be solution focused, not so much concentrating on the problems. And again, I tell a lot of people how we got here isn't, I mean, sometimes it is important, especially when there's trauma involved and there's stuff that we have to go back and process or we're not processing. So, but ultimately how we got to today isn't as important as how we're going to move forward from today down the line to try and resolve, again, your particular challenges.
Right. I think you've heard me say this before. We spend a lot of time figuring out try to figure out why I fell out of the tree, instead of saying I got to go to the hospital and take care of my broken leg. And me sitting there saying I'm not going to go to the hospital until I figure out why I fell out of the tree just doesn't make any sense. And we're here now, and we have to kind of be in that space. So I agree with, the idea of how building rapport, and that lived experience is certainly helpful to get kind of people to understand that, it's possible, and we kind of get it at a different level. So that's certainly valuable. What are some of do you think, the biggest hurdles that people have? The abstinence versus harm reduction, it's a whole different show. Like, we could talk about that for hours.
Yeah.
But when we're talking about, doing an abstinence-based treatment, and somebody comes to you and says, I want abstinence, what do you think are some of the biggest objections or hurdles or barriers that people have trying to move forward when you're dealing with people, do you think?
Again, everything's individualized, right? Like, as much as the problem of substance use disorder, I mean, the tools are kind of interchangeable. Again, everybody got to that point with a different story, right? So again, to me, it's kind of about understanding the story. Somebody comes to me, and then about dealing with the challenges, because there's always going to be challenges. I mean, right now I'm dealing with a client who's actually going into residential treatment, and he has people in his life going, why would you go, right? And because people are making judgments that, and that's challenging, whether it's family members, friends, social circle, acquaintances at work. Like, why would you go do that? Why would you want to stop? But again, people don't understand what's going on in the individual's mind or in the individual's heart, right? Because again, we're not necessarily expressing, right? I mean, you and I are of an age that boys don't cry. And I say boys don't cry kills a lot of men, because we, as men, we don't know how to appropriately express our emotional state, right? We'll hold it in, we'll tough it out. And again, that's again ties into the whole stigma, and your show and what we try and do as counselors to break that, because we should be talking about these things. We should be talking about our feelings. We shouldn't be drowning them out with substances or behaviors because we don't feel comfortable talking about them, right? So again, those are the other challenges that are involved, is that, I mean, again, there's a liquor store, or now a cannabis store on every corner, right? So, and ultimately, I mean, to me, is, individually, that was a coping skill that worked for a while for this person. So why won't it work today? Right? Because it worked for years when I first started, and then it stopped working, so I've stopped. Now, how do I remain stopped? Because I'll convince myself that, well, I haven't used it in a while. So, just one wouldn't hurt. Right?
Yeah.
So, and again, it perpetuates that cycle. And the challenge in that is that the brain remembers. Right? I mean, again, certain substances will actually almost physically alter the structure of the brain. When you talk about the way the dopamine system works, and you start talking about cocaine as a substance, right? And again, if you can break that down with the individual, if they are actually honest enough to talk to you about what they're actually using, right? And again, I usually start off with, I will do an assessment. I'll do like admission and discharge criteria tools, something like a standardized, just to get the information. And then use that and use their backstory. And it's funny, because when you start talking to a person about, okay, what about high school? What was the pattern? When did you have your first drink of alcohol? And then how'd that pattern build? And what about cannabis? What about any other substances? And you start talking about that, and they actually start objectively looking at their life. Then they go, oh, yeah, actually, maybe I should have been talking to you a decade ago. Right? So again, it's just, if we can find that and build that rapport to get them to open up, then you see these things. All those other challenges, I mean, we can talk through those challenges as long as they're willing to talk about them. And again, building boundaries, and being able to say, this is something I'm doing for me, right? Like, why would you do that? Because I need to, because this is about me. It's not about your thoughts around it. Right. So getting people to the point where they can, say that this is for my health. And although I appreciate your opinion, right, I'm still doing it.
Right. Right. There's certainly something to be said about the sense of low self-worth in having it where it's a comparison of what other individuals think they want for them, and not being able to have any sort of autonomy in that sense. So then, control comes from the addiction. But we're going to come back. We got lots more to talk about. There's so many topics on the table right now. So we'll be right back after this break with Trevor Mason. Trevor, so much information in the first bit there. I could pick apart all of that, and we could have like entire episodes just on each and every individual topic. So much great stuff. I really appreciate it. What I was hoping for the remainder of the segment is maybe talking a little bit more about your personal lived experience, and how that kind of curtails into the counseling. We touched on it a little bit in the front half. But I would love to learn more about your story and, what kind of got you into this work. If that's, if you're comfortable with that.
I am very comfortable with that.
Good. That's part of breaking down the stigma is, some people say recover out loud, right?
Oh yeah. No, I hashtag that quite a bit when I put posts on.
Yeah.
The fact is, and again, my wife laughs because we'll be at home and somebody will get on the elevator in our condo with a liquor store bag, and by the time we get to our floor, they know I'm in recovery. Right? So it's the fact is, I do think we need to talk about it. I do think we need to break down this shame that's associated with it. I mean, again, as I said earlier, I didn't wake up one morning and say, "Can I have a piece of that?" I mean, just my life led me in that direction, and this is, I truly believe it's something that you might be born with, or that you might develop, right? Because ultimately, again, when I found drugs and alcohol, they were a solution. I mean, for me, it started with alcohol. And, by the time I was 18, it was obvious I had a problem. Like at 18 years old, you shouldn't be drinking a bottle a day. Right? Not that I think anybody should be drinking a bottle a day, but, I was quite into it. And I mean, as an 18-year-old who was in high school, who can afford a bottle a day? So of course, my father finally figured out that I was funding my drinking out of his bank account, and said, "What's going on?" And so I told him, like, "Where's the money going? I'm drinking it." And my cousin, God rest his soul, he's not with us anymore, but took me to my first few meetings at 18 years old. And again, I didn't have a drink for 6 months after those first 3 meetings, but of course I slid into other substances. I just replaced it. So, and then when I picked up alcohol again, I had my daily, as I call it, my daily self-medication, because I was using cannabis instead. That became my daily thing. And then alcohol was this and that, I could take it or leave it, because I had my daily medication. Because again, at that point in my life, I wasn't comfortable in my own skin. Again, when I look at my story and my backstory, I mean, there's no what most people would consider trauma, right? But in my particular case, we moved every couple of years because of my father's job. So there was self-esteem, trying to fit in. There was a lot of separation anxieties, stuff like that I was going through at that time, and alcohol numbed that out, right? So I could, talk to people. Like nowadays, I talk a lot, and it's funny, people that knew me back then don't even hardly recognize me now, because I'm that much of a different person, because again, ultimately my recovery journey has allowed me to do a lot of work on myself, right? And again, once I removed the drugs and alcohol, I could start dealing with the problems that were Trevor. But I mean, all through my 20s was pretty much a write-off of different substances. And then again, I progressed as most people do, because of tolerance. I mean, I wasn't getting what I needed out of the substances I was using, so I was searching for the substance that would give me what I needed, right? And I have people say to me now, "Well, what was your drug of choice?" And I say, "More," right? Because it didn't matter. It was more of whatever was in the room, right? So again, through that, I was lucky enough that I got sat in front of a counselor. But I wasn't there for substance abuse. It was actually for court-ordered anger management. And he did an assessment on me. And he said, well, Trevor, I really don't see a problem with this anger over here, but maybe we should deal with this substance abuse issue over here. And I actually, as an angry 29-year-old, looked at him and said, well, I can't say it on TV, but something along the lines of, no, court don't know about that. And he said, okay, well, you can come here, but this is an abstinence-based office. And if you show up here under the influence, I'm going to breach you. So again, that gave me a place that I had to be clean to go. And I had to go once a week. So, so again, I had that, kind of 2 days a week where I was not using and going and starting to talk to a counselor and again, got introduced to an addiction doctor at that time and eventually came to realize that a lot of my repressed anger and a lot of my emotional problems was because I was numbing out all the time. And I just kept on building it up. Actually, it's funny because Bill Burr does one of his comedy sketches and he talks about repressing anger and, you stick it down in the jar and then you put it on that shelf in your chest. And again, that's what alcohol and drugs did for me, was allowed me to just get through the day and I wasn't processing any information, but here I was, this pressurized vessel just waiting to explode, right? Whenever somebody just cracked the cap off. So, and I mean, that's what I use. When I'm trying to work with a client at the beginning to get comfortable, there's a lot of things that I can just see because I can see myself, right? In that person that I'm trying to help. And I can say, hey, what about this? I actually understand how you feel. And which to me is important. Like, cause I can remember all those feelings. I can remember the compulsion to use, right? Where I didn't want to, I knew it was hurting me, but I had to, part of me had to, and it was the part that was driving it. So, because I can understand that in a person, I feel like I can connect with them on that level and be able to say, hey, look, life can be better, but we need to do some certain things, right? And the first thing is set down the substances, or at least slow them down. Like, right? Again, ultimately, it's funny because you look at somebody and say, look, okay, I'm going to teach you how to cope, but first thing I'm going to do is I'm going to take away your coping mechanism.
Yeah, it's a catch-22 for sure, right?
Right.
Yeah.
So
I see that, and one of my favorite sayings is we're emotional people that don't like our own emotions, right? So there's a certain conflict that we have within ourselves all the time, and that's what I'm hearing you say. Also, the value and importance of empathy and compassion as a tool to help build rapport. If I've personally sat across the table from mental health professionals that lack that, and they want to talk at you or opposed to with you, or being able to meet you where you're at, and that's certainly built some barriers, put some of those things in place. What I would like to know a little bit more of, what was the transition into working in the field? So we hear the lived experience, we hear the journey, the struggle, the self realizations. How did you get into this work? Like, what's the draw to become a counselor?
Well, I started in 12-step based mutual aid groups, and I got to a certain point where I was doing really well, but I wanted to know more, right? And so I decided I was going to go to university, right? I never thought at 37 years old I was going to start university, but I did, and I applied to McMaster, and I did because they have a great continuing ed at McMaster, and I did a certificate in addiction studies, right? So I started exposing myself to the theoretical model. Like I was working the practical model. And so I started going to classes, right? And it was funny because a lot of times I was in class and I was like, oh, that's what you call what I do. And the amount of information that I was getting, like around solution-focused therapy, I mean, then I, you know, doing the pharmacology course and starting to understand, like I did my, well, it's not a thesis at that level, but your big assignment. So I did it on cocaine, because again, it told me what had been going on in my head, right? I knew what the physical was. Now I was looking at, okay, well, why? And so doing that, I finished my schooling and I got my certificate in addiction studies. I was still helping people with Inside the Mutual Aid. And then the same counselor that had helped me, I was again doing a lot of work with his office and kind of helping people. And he said, well, why don't you get certified? I mean, you've got the education, you're doing all this stuff. So I did. I got my first certification, which was through the Canadian Council of Professional Certification.
Okay.
And that was in 2012. So, and then later on, I decided to kind of upgrade to a higher level of certification, and I got my CCAC through the CACCF. And I mean, then again, it was more about this personal journey. Like when I went back to school, it wasn't with this in mind. It was because I needed to know more about me. There was a program I was introduced at one point called the CEO of My Life, which talks about, you know, recovery, and whether it's recovery from substances or mental illness, very, very similar. And that 12-step programs will take you so high, right? I mean, kind of almost like out of the basement, and then you open up the door, and what's the next level of what you're going to do in your life? And that for me, that was going back to school and to learn more. But again, it was more about me than actually doing what I do now. But I mean, I'm really proud that and happy that I can help people now, right? Because again, going back to 12-step, we said we can't keep what we have without giving it away, right?
Yeah, so service is really super important. So we have to wrap up. I could sit here and talk to you all day, Trevor. One word that you can give to all your clients. Tell me, what's the one word?
Hope.
Hope. Awesome. I love it. Thanks for being on the show, Trevor. Really appreciate you being here. Thank you for watching.